Morning, everyone. Today's my topic is about the temporomandibular joint. The name itself gives us an idea about it is a combination of the temporal bone as well as the mandibular bone. So here, this structure is considered as a temporal bone, and this part is the mandible. Firstly, we discuss about the temporal bone. It consisting of two main components we need to remember for the temporomandibular joint, that is the mandibular fossa and as well as the auricular eminence. So it is called as eminence because it appears to be an elevated structure over here. So here you can observe how it appears. So there is a slope over here. So because of which it is called as articular eminence. The other structure we know is the mandible. Normally this mandible consisting of two processes, that is the condyle as well as the coronoid process. So this part of the mandible will articulate with the mandibular fossa which is present in the temporal bone. So this is all about the two main structures of the temporomandibular joint, that is the temporal bone as well as the mandibular bone. When these two articulates to form a joint called temporomandibular joint. So here we can see how well the condyle is articulating with the mandibular fossa. So this structure is the condyle and this part is the auricular fossa. It is also called as mandibular fossa as well as the glenoid fossa. So in between these two structures, here we can notice a one cartilage, fibrous cartilage type of structure, articular disc. So we will discuss about this over here. Here we can see clearly that the two articulating surfaces are separated by using a fibrous cartilage, which is the extension of the fibrous capsule which enclosed the temporomandibular joint. So this fibrous cartilage is also called as articular disc. This disc is a vascular structure which divides the joint cavity into two compartments, the upper compartment as well as the lower compartments. So in this picture we can see it clearly that the articular disc, how we divided the upper into two compartments, the upper and the lower one. So the main thing we need to know is, so this joint is formed by three structures, right? So first one is the mandible, temporal bone as well as the articular disc. So because of this joint is also called as complex joint, and this joint is also having the other name called as gynecoarthroidal joint. So because it undergo two types of movements, that is the rotation as well as the translatory type of movement type. So rotation is nothing but uh, the condyle will undergo rotation in its own place, so there won't be any forward as or the backward type of movement, whereas in the translation we see the forward as well as the backward movement. The forward movement is also called as the protrusive movement and the backward is the retrusive, and as well as the lateral movements we can see in the translatory type of movements. So normally this joint is also called as the synovial joint because the synovial fluid will be present in between them. So the upper and the lower compartments which we see here are filled with the synovial fluid. So here we came across that the mandible will undergo both the rotation as well as the translatory type of movement. So the lower compartment which will help only for the rotatory type of movements, whereas for the upper compartment will help in the translatory type of movements. So in this video we can clearly observe the both the rotation as well as the translatory movement. So here we can see how the mandible will undergo the translatory movement as well as the rotation. So whenever the patient try to open the mandible for about 20 to 22 mm, we can see only rotated type of movement which is within the glenoid fossa itself. So the condyle is not moving outside the glenoid fossa. It is inside the glenoid fossa itself. So after that, whenever the patient try to open the mouth beyond 22 mm, here we can see the translatory movement, that is the condyle is moving down along the slope of the articular eminence. We can see the downward type of movement. So this is how it is named as Gyglimoarthroidal joints because it undergo both the rotation as well as the translatory movement. I want to add some more points about the articular disc. That is, what the things we already know is it is a vascular structure and it is made up of fibrous cartilage. It gets its nutrition from the synovial fluid, which is already present in the joint cavity. So, the next thing we need to know is about its shape, which is biconcave in shape. So, because of this biconcave nature, the in the middle, that is in the intermediate zone, it is very thin, at which the condyle is going to articulate with the articular disc. So here we can see at the thinnest portion the condyle is articulating with this. So and the articular disc anteriorly and posteriorly it is very thick. So it prevents the condyle to move or slip away from the joint cavity. So it acts like a protective nature. So anteriorly it is bonded with the superior lateral pterygoid muscle and posteriorly it is bonded with the retrodiscal tissue, which is the vital tissue which play an important role when it comes to the temporomandibular joint pains. Coming to the muscle part, so there are four muscles which are most commonly involved in the temporomandibular joint movement. They are the masseter muscle, temporalis, and the lateral pterygoid muscle and the medial pterygoid muscle. These are the four muscles which play an important role uh, for the mandibular joint, that is temporomandibular joint movement. So the masseter muscle, temporalis, as well as the medial pterygoid muscle are also called as the elevator muscle, which is nothing but they are helpful in the closing of the mouth, whereas the lateral pterygoid muscle will be helping the mandible to open the mouth. So this muscle is also called as depressor muscle. So these are the primary muscles which are helping the temporomandibular joint movements. The next thing we need to know is about the ligaments. Normally these ligaments are nothing but they are helpful in the passive stability, so which prevent the beyond movements. So there are different types of ligaments present here. The first one is the temporomandibular ligaments, spinomandibular ligament, stylomandibular ligaments. The name itself says about origin as well as the insertion area. So this is all about the temporomandibular joint, where we learned about the temporomandibular bone as well as the mandibular bone, how they appear, and articular disc, the muscles involved in the temporomandibular joint, and the ligaments involved in the temporomandibular joint. So this is all about the video. Thank you for watching.